Hi, I'm Rachel Phillips-Anderson, and I'm a licensed clinical social worker in downtown Silver Spring. I specialize in treating people who are struggling with stress and anxiety. Today, I'm going to talk about OCD. I'm going to talk about what it is and then give some examples you may not be familiar with. I received training in treating OCD from the International OCD Foundation, and I've worked with people suffering from OCD for nearly a decade. So what is OCD? Obsessions are worries that get stuck in your head, and compulsions are the things that you do to try to get rid of them. So one example might be somebody who's obsessively worried that something bad might happen to their house when they leave. So they may compulsively check that everything's locked, make sure that everything is turned off, and they may even avoid leaving their house when not necessary. Other common compulsions include cleaning, organizing, tapping, repeating certain actions, seeking reassurance from others, looking up things on the internet. Some people may even read, reread, or rewrite things in order to get them just right. Very often, OCD will also include a lot of avoidance. And these avoidance behaviors may be just as disruptive for people as the compulsions. Sometimes the compulsions are mainly in your head and may include counting, reviewing things, or saying certain phrases or prayers to yourself. So one example might be somebody who's worried about saying something offensive, and they may compulsively review conversations that they've had in their head in order to reassure themselves that they haven't said anything wrong. Now, OCD is portrayed in the popular culture as often involving concerns about cleanliness or organization. And while these things are true, OCD can also involve any kind of worry that can get stuck in someone's head and that they engage in repeated behaviors to try to get rid of. So one form of OCD that you may be less familiar with is the fear of harming yourself or harming others. So some people may be so concerned about hurting others that they may stop driving their car because they're worried about an accident. They may stop being around certain people because they're worried about losing control and hurting them for some reason. Clearly, these are very painful worries. And it's very important to know that even if you have a persistent fear of hurting other people, this doesn't mean that you're more likely to act out in a violent or aggressive way. Other types of obsessions include dwelling on relationships or on moral or religious issues, as well as fears of contamination or of going crazy or losing control in some other way. Most people who have OCD realize that their fears are unrealistic to some degree, but they may be unable to control their compulsions. For a diagnosis of OCD, the cycle of compulsions and obsessions has to become so extreme that it really takes up a good deal of time, maybe an hour a day or more. And it needs to get in the way of activities that are really important to people, like maybe preventing them from spending time with loved ones. But there is hope for people who struggle with OCD. It's important to know that help is available and that with proper treatment, you can take back your life from OCD. One wonderful source for information is the International OCD Foundation. And if you think that you or someone you love may suffer from OCD, I really recommend that you contact a therapist like myself who's trained in exposure and response prevention, which is the #1 evidence-supported treatment for OCD. So if you're interested in what I've had to say, or you think that I might be able to help you, give me a call and we can see if we might be a good fit.